Now we'll be talking about tetracyclines. Tetracyclines are drugs which will bind to 30S subunit and it will inhibit the tRNA entry, and it is a bacteriostatic. Now it binds at 30S, so it will mostly stop after initiation. Now it's a broad spectrum antibiotic. We know that the number of drugs are doxy, demiclo, mino, tg. Now these three drugs are very important: the doxycycline, minocycline, and tetracycline. Why? Because all the other drugs are excreted via kidney, but the doxy, mino, and TG, that is DTM or DMT, whatever you want to call it, is going to excreted via bile, so it's safe in renal failure. Apart from that, these three drugs, outdated tetracyclines will cause Fanconi syndrome or renal damage, but these three drugs are not going to cause any renal damage. Okay, so next thing. So what are the uses? First, I'll talk about the use of tetracycline. The tetracycline doxycycline it's the longest and it is most safest, and it is used in Rickettsia, Leptospira, LGV, and chlamydia. So all these three and also brucellosis. All these cases they are doxycycline is used, especially rickettsial infections like typhoid, Q fever, Rocky Mountain fever, endemic fever. Everything you have to give doxycycline. Only if they are pregnant, then you have to give azithromycin or chloramphenicol. Why? Because the side effect of or even if children get rickettsial infection, very important, because it will cause yellow teeth and bluish black pigment, yellow bone and teeth enamel problems. And for other drugs, this is Lyme's disease, Leptospira, LGV, brucellosis, everything you give doxycycline only. On one case we give demiclocycline with this SIADH. Why? Because SIADH side effects is diabetes insipidus, nephrogenic diabetes insipidus. So you can give it or demiclocycline, but you have a severe side effect of photosensitivity. Now, apart from that, what are the side effects of each drugs? The side effect of each drug is that the main side effect is it will cause bone and teeth malformations, and for mother it is very hepatotoxic. Also individual drugs like minocycline will cause pseudotumor cerebri, and it also cause vestibular toxicity. And outdated tetracyclines will cause Fanconi syndrome or renal damage. And minocycline is also used in leprosy, if you remember that. Apart from that, doxycyclines or tetracyclines are used in prophylactic conditions like cholera, malaria, leptospira, or brucellosis, plague, and all these things they are used. Doxycycline is used.